Everybody, look, who we have here. Everyone, we're live on YouTube, we're live on Facebook, and we're live on Periscope. Awesome. And you're already getting hearts. You're getting purpley hearts already, just coming up just because you're so beautiful.
Yay.
Yeah. Okay, so you guys, tell us your names.
I'm Toshua.
I'm Journey.
And I'm Robert.
Now, how many children do you guys have?
3.
3 of them.
3 of them. Oh my goodness.
No, Maximus.
Maximus,
our dog.
Yes, our dog.
4.
Yes.
Your dog. Okay,
Yes.
very important.
Okay.
So how old are the human beings?
How old's Kelsey?
17.
Good job. How old's Emma?
9.
How old are you?
6.
How old's Max?
7.
But he's
7
not a human.
months.
Yeah.
But
Okay.
he's not a human being.
He's
right?
not a human being.
No.
Max is a dog.
Max is a dog.
Yeah.
Okay, guys, so some questions. You two, when you were pregnant with your first, were you guys anti-vaccine?
No.
Okay, what did you think about vaccines?
I worked for a doctor, so I believed everything I was told, and that we're supposed to believe the doctors, and we're supposed to have faith in them because they are doctors.
Yeah, exactly. No, that's it. The brilliant brainwashing. They're
Yeah.
doctors, they wear white coats, they have a medical degree, so we bow down.
Yes.
Not anymore, peeps. Now, what did you do at the doctor's?
Well, I gave shots, steroid shots, antibiotic shots. I numbed people for in-office procedures. Gave oral antibiotics, or topical meds, and stuff like that.
Yeah.
So what did you think about people who did not vaccinate or children
I
that
thought
were
they were crazy.
batshit? That just came from nowhere. I don't know where that came from. I'm sorry.
Okay, that's great.
I'm sorry. I think that's what they call me. Just came out, peeps. Sorry. I don't normally swear. This band makes me swear.
I thought they were crazy. I did.
So you vaccinated your kids
All of them.
on time, on schedule, anything they
No.
told? Okay,
No.
tell us.
So when Kelsey was first born, that's when Jenny McCarthy and Jim Carrey came out with vaccines were causing autism.
Mhm.
And so we got married, and 8 years later we had Emma, and it was being talked about more and more. And so we decided that with our middle child that we were going to separate the shots out. That it's not going to touch us as long as we spread them out, that they would be fine. And so with Emma, if she was supposed to get 6-month shots, she got them at 8 months, and then we just kind of separated them out so she didn't get them on time. Didn't seem to have an issue, so we decided to do the same thing with Journey, and everything seemed to be fine. So she was vaccinated in the hospital. She had the whooping cough vaccine. She had the hepatitis vaccine, or the Hep B, and was that it? And I had the flu shot while I was pregnant.
Yes.
Yeah.
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 And so then we started spreading her shots out, and then at 18 months she was getting ready to go into daycare because we needed a new sitter because before that my aunt was watching her. So it wasn't prevalent that we needed to have any vaccines. So at 18 months we went in, and she got 3 shots in one leg and 3 shots in the other leg. And I recently found out, 3 months ago, that wasn't even that long, that even though they say it's 3 shots, that there's really more shots in instead of just the 3, which kind of blew my mind and made me mad. But
So don't they think they should have taught you this kind of stuff when you were working in a doctor's office?
Oh yeah, because I drew up shots. I knew what it was like when I knew what was in my syringe. And so in my syringe, if I gave an antibiotic, it was diluted with saline and then whatever the antibiotic was. Like, there was no mixture of medications that I was giving these people. Does that make sense? And so that's what I trusted in them, was that if you tell me that you're giving my child 3 shots in one leg and 3 shots in the other leg, that's all that there is just 1 shot each, not just multiple together.
Do you feel that, who trained you to do the job you're doing? Was it the doctor's office, or did you go to some kind of
I went
college?
to school.
Do you feel let down by the people that trained you?
Yes and no. I also feel let down by the doctor, but then he trained me to the best of his knowledge. So I didn't work in a pediatric office. I wasn't giving that type of shots. So what he trained me on, I knew what was in my shots. I just wish that the pediatrician had came and said, you're actually going to get this and this in this shot and this and this in this shot instead of...
This could happen to you.
Yes.
And did you know that they were making money from vaccinating your children? Did you have any idea that there was bonuses given for full?
Did you say bonuses?
Well, they get bonuses. They get money. They get money if they can. They've got a full clinic of vaccinated kids. They get big money.
Well, I wasn't quite aware of them actually getting a certain amount of money for vaccines. I know that drug reps come in and they get...
One pediatrician said $700,000 a year he can get in his clinic if he fully vaccinates.
Wow.
That's why they get so cross when you don't vaccinate and they chuck you out the clinic, because otherwise they won't get their bonuses.
No, I didn't.
Why else would they throw you out? There's no reason to throw you out.
Right.
Yeah.
Right.
Had no idea that that's how this worked. That they get paid extra money to vaccinate these kids.
Right.
Follow the money train on this, guys.
It's... When we found out that they were giving her more than what was told to us, it was actually quite upsetting. And now it does more to me on the inside. And it angers me at doctors. That's why I typically don't like going to the doctors now, is because it's almost like, what can I do to make money?
Yeah.
Like, what can I tell you? What can I do to you? How, instead of fixing my issue, it's, here, try this, and then come back and we'll try more. And it's sad that this is how they treat our children, and that this is how our kids are being taken care of. I'm not saying that what happened to Journey was a burden to us, because it was an actual blessing, because it's opened our eyes to so much more of what they're doing to our babies, that we can sit and tell people, hey, this is our story and this is what happened with us. We just want you to see that there's more to this than just saying, oh, well, you need to have these shots. Well, no, you need to tell me what's in these shots, because I want to know what you're putting in my child, because I need to know, because when things happen, we need to be able to understand, okay, this is what they did. How do we counteract what they just did? And how do we fix that? Just to say that that's sad. And that it's unbelievable that we have people who would, well, I guess it's a broken world. It's a broken world with broken people, so.
Yeah, there's a lot of children with a lot of injuries, and you are doing so well. Do you know that? Yeah, you really are. You're a good person that speaks out for all of the people that are injured, and we're very grateful to you. Now, so you worked in the doctor's office. What about you? What do you do?
Well, now I'm a pastor at a school.
Nice.
Yeah, I'm a pastor for the local Christian academy here in town, and I've been there now for 4 years.
Lancaster Christian Academy.
Yeah. But then...
And they don't care that you're vaccinated or not vaccinated. Where most schools say you have to be vaccinated, we need shot records before you can come in. They don't care if you have them or don't have them.
It's really sad that we cannot get the churches on board. You know, my church have been fantastic, but it took one elder to say, no, we're not playing this film, because, you know, I don't think this is right. And they're petrified.
Yeah.
Which goes, you're either, how many times does the Bible say, do not be afraid, have no fear?
A lot.
Just in one chapter alone, it says it at least 4 times, and that's just in one chapter, and that's in Joshua.
You know more than I do.
Oh gosh.
It's from the Bible.
It's in the Bible, but yes, just in one chapter of the Old Testament and one of the books, it says it at least 3 to 4 times right off the bat. It says, do not be afraid of them. It says, be strong and courageous,
follow God, not mankind, etc., etc., etc. So I'm really deeply, and I'm not on my own, the peeps feel the same way, so disappointed and shattered by the churches that are so afraid to address this subject. And there's nothing about this that is okay. It should not be okay with them. God did not make a mistake when he made our kids with the immune system, with anything else.
Our bodies
Aborted
are made
fetal
to-
fragments, no, church, we don't like that. Why are they not standing up? Why are they so afraid? And you don't have the answer, I know. I'm picking on you because you just told me you're a pastor.
It'd be just like any other thing that we can be kind of scared to introduce into any pulpit.
What's change?
Because when you have change of any sort, sometimes people are afraid of change. People are afraid of what may happen to their livelihood and the things that they're going through in their life. That's what keeps them away from us. I won't exempt myself. That's what keeps us away from speaking on big topics. For me, this is important to me, because this is my reality. This is my baby. And so, and there's certain things, it'd be just like a race issue. Why don't we want to discuss race issues? Because we're afraid of what's going to happen to the fabric of what happens to our livelihood, what happens to our church community, what happens to our money. And without setting those things aside and being worried about kingdom, we'll never get to a point to where we can't just be like, okay, let's discuss this and let's talk about it. What's right is right, what's wrong is wrong. And how do we deal with it scripturally in the church is where we need to be focused at, and not focused on the dollars or how many members we're going to lose or anything like that. We need to be focused on building the kingdom. Right, babe? Yeah.
Yeah, we keep saying over and over again, no matter whether you have faith or not, no matter, wherever you think you're going to go when you die, you cannot take your money or your possessions with you.
Okay.
Right, just saying that.
Yeah.
Just forget the faith thing for a
real.
second. Just
That's
what do
real.
you want to do with all this money? Because you are going to die at some point. Everybody is.
Yeah.
So we know where we're going. But for those of you that are not into it, you still can't take your money with you, whatever happens. So how can they put money before God? How can they put money before human life? I'm off on one because he said he was a pastor. Sorry, I've been dying to go off on this subject for ages. It's stressing me out. All right, let's get back to you, because the story's about you. So, how old do you say?
6.
6. Now, do you go to school?
I go to John Coleman Elementary School.
Is that where you are?
No.
No. She is, John Coleman Elementary School is a public school here in town.
Where she gets occupational therapy and speech.
Now, do you have friends?
Yes.
Are they nice to you? Good. Is your teacher nice to you? Good. And what's your favourite thing you like doing at school?
I'm doing things to my book. I can read.
You like to read.
You like to read. And what do you want to be when you're a big grown-up girl? What was your favourite thing in the world?
I want to be able to grow up like a bus keeper.
Bus keeper.
You want to drive a bus?
Like mom?
Oh.
Are you a bus driver?
I drive a special ed bus.
With
do.
Jill's bus. Like Jill's bus. You know Jill?
Oh,
Yeah,
like
Jill.
like
Yeah, Jill
and
owns the
Jill.
bus,
And
and
Jill.
I drive the bus.
Do we need really kind people to drive these buses? Yes, we do, because there's a lot of reports of abuse that goes on these buses. Billy suffered the same thing as a child, and a great many of my friends, and these school buses and buses, special education buses. So thank you for being a very kind. You'll be a kind bus driver. Yes.
I think that's what opened my eyes within these last 3 months, is that I see how many children I have on my bus that either are verbal or nonverbal, and all of the stuff that they deal with. And I had a brother that had autism, and he had multiple health issues. And so it's just eye-opening to see, and it makes us want to dig deeper to find out, how to protect our kids. So.
Well, you're doing really well. I mean, there's many parents with children diagnosed with autism love, this understanding, intelligence, all that kind of thing. What do you feel about the fact that all of this could have been prevented? You didn't know.
Right.
And now that you do know and you've done your research.
Well, we've decided that if we have another child, because it's basically God who gives us another child, and if he decides that we can have another one, then we'll have another one, but that they would not be vaccinated at all.
And you wait till you see the health differences. Have you seen some of the stories that we've recorded and the health of the unvaccinated?
I have friends who have children that are vaccinated and some who aren't vaccinated, and they've never been sick, where ours are constantly sick. I mean, the first 2 years of her life, she had 6 different ear infections. She couldn't hear.
This is after vaccination. Now listen, I'm the parent that I will typically not bash anybody or talk crazy about anything.
He thought I was crazy for the longest because he had no idea. Yeah.
But however, after being educated on some of the things that they are putting in our kids, like for the first year of her life, things were good, and then
18 months,
and then when we started getting more shots, it's like things started to happen, and things started to happen, and it was more, and she was constantly sick. And I remember saying to Toshua, why is she always sick? What are we doing wrong? Did we not keep her in the house long enough before we took her out, into the world? But I'm seeing people who are not vaccinating their kids, and they're bringing them to church a week, 2 weeks after they're born, and it's like, what have we been taught? And what are they not telling us that they're putting in our kids? That will make me not vaccinate our kids after that.
So, and once you start doing the research, it's absolutely petrifying, horrifying that you even put that stuff in your kids in the first place.
The oldest, Kelsey, she's been to the doctor 3 times now, and every time we go, they want her to get the Gardasil shot. And I'm like, well, we're not getting the Gardasil shot. And so we changed doctors and went to a new one, and the one that we have now they don't ask. It's not a big deal. It's kind of like, you do what you want to do, and that's fine. But the first one was, okay, well, then you can just let your child have cervical cancer. I was like, well, we'll take that when it comes. We'll take that one.
And this is the vaccine that they don't know if they're giving cervical cancer or not.
Right.
Well, I haven't seen anything good come from this vaccine except for death and devastation. Every shutting down,
paralyzed.
going through there is nothing good about this vaccine. And yet they say, have fun with your cervical cancer child.
Right.
How can they get away with that?
Yeah.
Evil beyond evil.
So, but we did her the same way that we did Emma. She started getting shots, and so if she was supposed to get 6-month shots, we went to 8 months. And by the time she was ready to go into daycare at 18 months is when she got the 3 in each leg. And so with the 3 in each leg, it was 2 days after. Well, she got a fever immediately after, and then the next day. And so by Wednesday, we called the doctor, because she was on an antibiotic for an ear infection, and that she did not have before we got the shots. So got shots, then got an ear infection. They put her on antibiotics. After the antibiotics, she started pooping out what looked like blood. So I called the doctor. The doctor was like, it's just the antibiotic. She'll be fine.
It's normal.
It's normal. It's just the antibiotic. It's normal. So she started jerking at this point while she was sleeping. And we just thought, call the doctor about it. It's muscle twitching. It's totally fine. It's normal. Friday, I'm at work, and I'm working at the doctor's office. Dad is working for the city of Laverne. And my aunt calls you, I guess.
She calls me on the phone.
Yeah.
And she says, hey, there's something wrong with Journey. And I go, okay, what's wrong? I'm pulling up now, and I was actually pulling in the driveway. She's like, I don't know. She's just not responsive. She seems like she's having a seizure. And so I walk in to my child having a seizure in her uncle's arms, and it's just, And I don't understand, and I'm just standing there, and there's nothing I can do. And so we call the ambulance, and she seems like she comes out of it, but instantly she's right back in it again.
Petrifying.
Yep.
And I'm just like, I'm beside myself because I'm like, what is really going on? Like, we went from sick to seizure to like, what is happening? Like,
I get the call.
How old
at
is
work.
she then? How old?
18 months.
18 months.
This is the same story as Billy's, by the way. Have you guys watched Vaxxed?
No.
I'll give you a copy.
No. Yeah. So I get the call. I'm at work. My husband calls and says Shirley's had a seizure, and I break down.
Okay.
And then all of the doctors that I was working for came over, and they're like, "What's going on? Have her sent to Vanderbilt." So he's like, he's in the ambulance with her, and he keeps saying, "Toshua, like she's looking at me, but it's like she's staring through me. It's like she doesn't even notice that I'm there."
Yeah, it was.
Yeah, and so it took forever because she didn't actually come out of it until they got to Vanderbilt. And so from Laverne to Vanderbilt, it's about 20 minutes. 15, 20 minutes.
15.
No, it was a little thing.
It was a little thing.
It was cereal in my
Well, you
throat.
just coughed right now.
Yeah.
Oh, okay.
So we got to the ER, and they were super busy, and they had no room, so we ended up sitting in the...
They had no room because it's not emergency, because it's normal to have a seizure.
Apparently.
Yeah.
Because we were sitting in the hallway, on a bed in the hallway, because they had no rooms. They basically just drew some blood, checked her urine, and said that she was allergic to ceftonir, which is the antibiotic, and she had a febrile seizure, and that it'll continue to happen every time she has a fever.
Of course. So there we go, peeps. It's not the vaccine. It's the antibiotics. Anything but the vaccine.
Right.
It's antibiotics. It's normal. It's common. Seizures rewire your brain and all that kind of stuff.
Yeah.
We've heard it all before.
Oh, no, I was told it's the way that her body handles this spike in the fever.
To have a seizure.
Yeah. That it just gets out.
That it protects.
It protects her body, is what we were told.
So the seizure is a way of showing you guys that this is just protecting her body.
Yes.
Oh my goodness. These
Yes.
people are so dangerous. I can't even.
Yes. And so from there,
Write that down, peeps, for our book. Quick.
From there, she was... So before all that happened, she was talking, communicating, and she could point. She could... If she wanted a bottle, she'd say bottle. If she wanted a blanket, she'd say Kiki. Mom, Dad. She was talking. After that, she stopped talking. She couldn't communicate. She couldn't point. I had went to the doctor, and it took 6 months for the pediatrician that she does not have now to say, "Oh my gosh," because at first this is normal behavior.
Yeah, it was
normal.
It was no. You guys are just. It's okay. It's fine. This happens. You know, it'll catch up. But it was fits.
Yeah,
it was no communication at all.
Hitting.
It was hitting, biting, screaming, falling out, and I mean falling out. You know what a regular temper tantrum is,
Right.
From a regular child. This was not. It was more raged, and we couldn't understand like what it was. Do you want a bottle? Do you want to? What do you want? Help us. And it was, so she would go to the doctor and tell the doctor, and he would basically just.
She's fine. And then at one time it was our fault that we were training her to be the way that she was.
Learned behaviors.
It's always your fault. You must know if it's normal, but it is always your fault.
Yeah.
It's either your breast milk or it's something that you are doing.
Yes. So it was our fault.
It's just Billy when the door comes over.
That's okay.
Hi, Bill.
Hi.
You want to give me that phone?
Because we don't. It's a 5% battery.
You want me to charge it?
Charge it.
Okay. We'll see you in a minute then, Bill. Thank you.
Thank you. Keep it safe.
I'm keeping it safe. Everything's safe. Everything's safe. Look, we're blocking. Everybody's blocking. No one's going in that room. No one is going to touch your stuff. Sorry about that.
Okay. So, so I finally went to the doctor, and it was just her and I and the 2 other girls. And there was apparently something that was in her diaper bag, that was her backpack, that she wanted that I apparently had taken out. So she's thrown a fit. I give her the bag. She can't find it. So for 10 minutes, the doctor sat outside the door to listen, then came in another 10 minutes to where she had exhausted herself so much that she fell asleep. And he was like, "I now see what you're talking about. let's get TIS involved and have her checked out. And that's what started the process at the age of 2. So then she got into school at the age of 3, and the fits started calming down. We've not done any medicine. We do Benadryl every now and then because she's allergic to cats and dogs.
So is there anything that would make you guys vaccinate yourselves or your children ever again?
No, we haven't had a flu shot in years.
Oh, killer flu's on its way.
Yeah.
Killer flu, and if you don't get vaccinated, we're all going to die.
No.
Kelsey's
Well, see, we can pray big.
Yeah.
That's what we do here.
Right.
Kelsey's teeth fell out.
Oh yeah.
Oh, yeah.
Wait, who's Kelsey?
Our oldest.
Now,
Yeah.
she did tell me she didn't get the Gardasil.
She did not.
No.
Okay,
No.
Her teeth is bleeding.
Her
Yeah.
tooth is bleeding.
And that's
Pulled
kind
out,
of where we are now. We want to know more. We went to the dentist, and they wanted to do a silver crown, and so we kind of went back and forth yesterday because I did not want the silver crown. I just wanted them to pull the tooth because I didn't want the amalgam that is in the metal, the mercury in their mouth. They wanted to do a root canal, and so we ended up pulling the teeth.
You have beautiful teeth.
And now we're kind of not sure if that was the right idea to pull the teeth. So we still want to learn more. We're not making the best decisions. We do know, however, that we're not going to vax our children. And so we're wanting to know more.
We've got some loudspeaker in the middle of our story. Okay, there's obviously something going on. I'll tell you what we'll do, guys. We'll come off from this story in a sec, and I'll take you. There is some fun things going on outside. They've made such an effort here today.
They did a great job.
Now, is there anything you guys want to see? You must see Vaxxed.
Okay,
It will make you very angry
Yeah.
when you hear what the
That's what we've
whistleblower
heard.
said. It will make you guys angry.
Yeah.
What's
I heard
that
that there were
pillow?
several
What's what?
doctors that came out and
Is it
said,
Max pillow?
What are you looking at?
"Oh, the Vaxxed pillow."
It is. It was made by one of our lovely peeps. What do you think?
And I think.
Yeah. I think it's
I think-
good. It's a t-shirt turned into a pillow.
Oh, that's awesome.
So you know the t-shirts are outside. She just sewed it into. What a clever idea, don't you think?
That's nice.
Yeah. What is that? What is that?
It is a shot.
It is a shot, right?
I have a shot right here. I almost heard it.
No more shots, okay?
No.
Nope.
As Billy says, vaccines are for hell.
Oh.
That's awesome. Does he really?
You go and ask him, yeah.
Okay.
He also has a list of other things like the Chuck E. Cheese rat and various other things. So, yeah.
Okay.
What can I say?
Baby.
Is there anything else you guys would like to say to these lovely peeps?
I would just love to say that we just want to bring awareness to the community.
Thank you.
That
We have nephews that have been vaxxed.
Yeah,
And that one has followed her
I think
to the T.
to a
18 months, had
yeah.
febrile seizures.
Yeah. And I think
Can't
even,
really communicate.
even our oldest nephew that we have, who is now in college.
Oh, yeah.
It's
When
Malachi.
he was young, he had Malachi. He had ended up getting bacterial meningitis somehow.
He's in
Lost
college
hearing
now.
in his ear.
Lost hearing in his right ear and everything. I'm just going to say, if he was vaccinated, I believe that may have been a cause, and nobody can steer me away from that. But we just want people to be aware of the things that are going on around the babies, because as a pastor, I'm just going to say this: the babies are important to the kingdom.
Yeah.
I mean, God's heart for our children is huge, and He speaks about it in His Word, and He is very specific about that. And we need to love on these kids, and we need to take care of them, because it is so, as my mentor would say, it's muy importante. Very important. Very, very, very important to the kingdom for these kids to be raised up and to grow up with a wholesome life, and to not be messed up. So...
Amen from me and the peeps.
Yes. Mine is that I want people to know that you can't, yes, trust doctors, but they're also practicing, and God gave them to us for that. He's the ultimate healer, and they're just there as a practice. And so to research everything that they're asking you to do. They may convince you to do this or convince you to do that, but you can always say, I would like to think about it and come back. You don't always have to be forced into doing things as we have. We were forced into getting 3 shots in each leg, which turned out to be more than that, and now we are living with that for the rest of our life. So we just want people to be educated and to know that they don't have to be brainwashed.
And there are natural ways.
There are natural ways.
There are natural ways to take care of things.
Just look at the health of the unvaccinated. You
Yeah.
can't argue with that. That's so healthy.
Yeah.
Now, when you have your next baby, I want photographs.
Of
Okay.
course.
I want everything,
Of
okay?
course,
And then
of
you guys
course.
come back on the bus when that baby's like a year old,
Okay.
and you tell us the deal.
Okay.
Because I'm pretty sure I can write your story right now.
Okay.
Okay.
You watch for no ear infections in that first
Praise
year of
the
life,
Lord.
no antibiotics. Make sure you breastfeed.
Yes. That's the.
Read Dr. Suzanne's books. Watch Dr. Suzanne. Do you know who Dr. Suzanne
I
is?
don't.
Okay, Dr. Suzanne Humphreys. You guys both look her up.
Okay.
She's a big woman of faith, and she's an overqualified doctor, just like millions of qualifications, and she's brilliant. Her stuff is fantastic.
Okay.
So we got some educating to do with you guys. Okay, we need to give you books, we need to give you DVDs. There's things to do,
Okay.
and we're relying on you to you know, we've got to get these churches. Everyone's got to pray big. That's our big thing here. Everybody has to. This is a spiritual battle, and we all know who's going to win.
Yes.
But you guys have got to do the pray big bit.
My
Okay.
leg hurts.
I wish I was a pastor. I want to get out there and go pray big. We're going to have the Peeps ministry one day, Peeps. Okay, we're coming off. I'm going to come back on and show you what's going on outside because I need some fresh air as well. So here we go. What is going on outside?